Okay guys, so I am back in the ER. I'm actually have my IV hooked up to IV antibiotics right now, but I had to go to the bathroom, so they took it off. I got poked not once, not twice, but 3 times. Since I've been here, and as you can see, it's gotten a little messy. They gave me some, like a really small dose of Ativan, so I'm starting to like not be as scared, but I was like crying and like freaking out earlier because they told me like don't eat or drink anything, and like, you know, that they're gonna have to do like run some more tests and do some procedures and like a CT scan, and like where they put like iodine in my IV, and it makes me feel funny, and you know me, I like freak out about stuff like that. So, but the doctor did say that he's really glad that I came in, so hopefully we can just get some IV antibiotics and get this infection under control. Hopefully that's what it is, and they're able to fix it quick. There's Trav. We'll keep you posted. Okay, you guys, so I just got out of the shower. My hair is wet and looking crazy, and I had like a huge zit right here, so don't mind that. And I feel like this is like my new aesthetic, like fucking bed rest. This is like my new brand of like just being fucking sick all the time. I'm joking. I don't want to put that out there into the universe. I'm making a joke to deal with what I've been going through. So, I don't know if I'm going to put this at the beginning of the vlog or after, but either way, I went to the emergency room last night because I could not stop retching, and I just felt very sick. My pain started to get a lot worse, and I started having more bleeding, like vaginal bleeding and pain, and I knew just like something was not right, and like I just have not, there's been something that I've just been feeling in my gut, like something does not feel right, like, you know, something's not right. And I thought that it was an infection, and that's what my doctor thought it was, and he had me on antibiotics, as you guys know, and I've been on bed rest. Well, shit got worse, and I'm like, this is not normal, and he said to go to the emergency room if I started retching. So I went to the emergency room last night. They drew my blood a bunch of times. Oh, you can come in. Travis, my amazing husband, just made me some food because it's like 3 o'clock and I haven't eaten yet, so thank you, honey. You want to show them what you made me? It's so bomb.
Do you want to... I'll show it in... Wait, do you know what everything is in it? Okay.
Yeah, I think you put... Did you put mushrooms also? So there's mushrooms, onions, avocado, tofurkey, and hash browns. And it's all mixed in. And then I mix in ketchup and Tabasco. And oh my god, you guys, like one of my favorite vegan meals. It's not super healthy because of the hash browns, but everything else in there is pretty good.
That's why I always push you for the vegetables. So I pushed her into the onions and the mushrooms.
Yeah. So, okay, so let me just kind of give you the flow down of what happened yesterday. So we ended up going to the emergency room, and I always call my mom, like, Mom, do you really think it's necessary for me to go? Like, because I don't like going and taking up space in an emergency room if I don't feel like it's an emergency, you know?
You want this on?
Sure, thanks, yeah. And my mom's like, yes, definitely go. So I ended up going, and my hospital's a little different. Instead of like bringing you right back to a room, they make you meet with, like, in the waiting room, there's like a nurse and a physician's assistant, and then they have a place to draw blood, like all in the waiting room, and like to give your urine and stuff, because I think they don't want to take up beds either. If someone is like not that sick or whatever, they get to send them home, and that way they don't have to see a doctor and, you know, whatever. So what happened was they came out and they're like, okay, we're gonna draw your blood. So I don't know if you guys can see that or not. This vein got real fucked up last night. It probably will be really bruised, but you can't like tell yet. So anyways, they draw blood. No joke, like 10 minutes later, the same phlebotomist comes out and he's like, I'm so sorry, but we have to draw your blood again. And I'm like, why? And he's like, they want to do some more tests. So whatever happened, they got whatever test back. Something clearly did not look right. So they wanted to come back and do another test. So then they have to poke me again, right? So then, which is fine, because like, you guys, I don't even really care that much about needles. But it's just like, you don't want to get poked twice, you know? But then they come out with the second time, like to draw my blood, and they had these huge like bottles of stuff. And I'm thinking like, oh God, are you gonna put that in me? Like, and they're like, no, we're just putting your blood into these like bottles that had like all this fluid in it. It was like, they were big bottles, like big glass jars. And it just kind of like freaked me out. So I started getting anxiety because I'm like, oh great, like something is like off. And you know, I started getting worried, you know. Then right away I have another lady come out and she's like, okay, so we're going to be doing a CT scan, an iodine like CT scan, basically where they have to put iodine through an IV and it makes you like all hot and it feels kind of funny and they put you in the tube or whatever. And so then I just started like freaking out because I'm like, fuck this. Like, yeah, I want to figure out what's wrong with me and get it fixed. But at the same time, like, I just wasn't expecting to have all these like things done or whatever. And you guys are going to freak out when you find out like what happened at the end of this, because not only was I shocked, but my doctor that did my surgery says it's the most bizarre thing and he's never seen it before. So it's just really crazy. So just stay tuned. If you hear loud stuff, it's Travis is packaging up giveaways and like Poshmark stuff. So then they realize something's wrong. They get me a room in the ER and they're like, don't worry, the doctor's gonna be with you shortly. I'm full on having an anxiety attack right now because I'm like freaking out and they're telling me to not eat or drink anything. So now I'm thinking I'm gonna have to go into surgery for something. Something is not right. Like, and during this time, no one's told me anything. Like, I haven't talked to the doctor. No one's told me anything. They're just running a bunch of the tests and like, you know, the doctor's gonna come talk to me eventually. So I go in and I'm freaking out and they do the IV in the same fucking place that, okay, so I had a poke here and then I had a poke on this arm, and then they put the IV in the same place that like I literally got my blood drawn, and the poor nurse, she like squirted blood all over her, like all over herself. Well, not in her face or anything, but like it did get like I think maybe on the floor and maybe a little bit on her clothes, and it got all over me. Fine, again, not worried about that. It's just like so many things were happening and it was just like causing a lot of anxiety for me. And then like right after that, the doctor comes in and he was so nice, and made me feel really comfortable, and even said like, we're really glad that you came in because, you know, this is like a serious thing, having an infection and all these other things. So he's like, I'd really like to just start you on some IV antibiotics while you're in here. We'll get you some saline. And I was like, you know, I'm really like scared and nervous. And he's like, don't worry, we'll give you something for, you know, your anxiety. So I was like, okay. So they ended up giving me some like Ativan. I asked them just to give me like the lowest possible dose that they could, which they did, and that like helped a lot. And then they took me in to do the iodine test, which it literally feels like you're peeing yourself, and it just makes you really hot, like all in your chest, and like your insides feel like really warm, and it's just like a weird uncomfortable feeling. I thought it was gonna be way worse than it was when she was explaining it to me, but it really wasn't that bad, but obviously still freaked me out because they put you in a tube, and Travis wasn't allowed to go back there with me, so I was by myself. But anyway, make long story short, they're like, so basically we found like a bunch of blood behind your uterus that's like, you know, sitting there, and that's most likely what's causing your pain and nausea. And, you know, but don't worry because your body should absorb it. Just stay on bed rest, and, you know, stay on bed rest and take pain medicine if you need it. But it should go away in a few weeks. But if the blood gets worse, maybe come back because, you know, it could mean that you might still be internally bleeding from your surgery. So I'm like, okay. But he did say he didn't see any infection. So I'm like, that's really weird. But I was really glad because there was no infection. But at the same time, I just thought, okay, so all of this is caused from this blood? Like, that's crazy. So they discharged me. But again, I feel a lot better because I think like I'm totally safe now because I don't have an infection, and I'm just gonna have to deal with like the pain, but it's fine, right? Well, I get in the car. And they always give you this little sheet. Let me just make sure like the doctor's information is not on it. So they give you this sheet of all your blood work and everything when you go home. Well, this is the kicker. You're not gonna believe this. And I honestly cannot believe that the doctor didn't even mention this. I'm still pregnant. My HCG test came up positive, and not only am I still pregnant, my HCG level is at 2,644. My HCG level before my surgery to remove my tubes and do my DNC, which was to get the pregnancy out of me, was 309. So my HCG levels have risen significantly, and the doctor didn't say anything. He didn't even say you're pregnant or anything like that. And I told him my whole history of like what had happened, that I had just had surgery and I had it at the hospital. So all my notes and all the chart stuff is in there, and he didn't even fucking mention it. Like, I think that like right when you go into the emergency room, every time they give you a urine test to make sure you're not pregnant before they treat you or do anything that could harm the baby. And he didn't even mention it. So last night was so tired. We got out of there really late. So I was like, I'm gonna go to sleep. I'm not gonna try to worry about this. I'm gonna call my OBGYN tomorrow because it's Sunday. And I'm gonna try to reach him on call and see if he can give me a call back and see what he says about this. So I call him. He calls me back right away. And he's like, I'm shocked. Honestly, cannot believe that this actually, I didn't record the whole conversation, but I did record some of it, and I'll put it in after this. But like, he specifically said that he was shocked that the ER doctor didn't say anything about the HCG levels and the fact that I was still pregnant. And my doctor is also like just completely flabbergasted. He kept saying over and over, this is so bizarre. I've never seen this before, because you guys normally 99.9% of the time, if a pregnancy is not in the uterus, it's in the fallopian tubes, and we removed all of that, and we removed anything that could possibly be in the uterus. But I'm still pregnant and it's growing, and we don't know where it's at. The doctors don't know where the pregnancy is growing. He said it could be growing on the ovary. He said it could be growing like near the bowels or on the bowels. He said it could be growing behind my uterus. He doesn't know. And they can't see it on an ultrasound or thingy or whatever. And so, yeah, it's just, the problem is, you guys, is like, it's not a viable pregnancy still. So I don't like want you guys to think like, oh, how exciting, you're still pregnant. Like, I'm pregnant, but it's not good. It's not good at all. It's very dangerous and detrimental to my health because it's not where it's supposed to be. And the doctors don't even know where it is. And they need to get it out because it can't survive wherever else it is in my body. And it's just not, it's very dangerous. It's not good. So my bleeding has actually gotten worse since yesterday. It's now like bright red blood, and it's a lot more blood. But yeah, basically my doctor said that we're most likely gonna have to do a methotrexate, and I'm gonna have to go into the hospital and get it. It's a chemotherapy drug, and basically what it is it just like it kills like cancer cells, like rapidly growing cancer cells. It also will destroy rapidly growing pregnancy cells, or like, you know, where the pregnancy is. So that's really gonna fucking suck, because at this point, like, they're probably gonna have to give me more of that medicine because it's so much later on and the pregnancy is bigger, and it makes you extremely fucking sick. So, you know, it's just been a hard it's been a hard past couple months, but like I said, I don't know what else to do other than to try to be strong and just get through it, because I have no other choice but to do that. So that's what's going on. I will keep you guys updated, and yeah, that's about it. Thank you guys so much for watching. I'm sending you all my love and all my positive energy, and I hope to see you in my next video.
Order a vaginal ultrasound on Monday or Tuesday. By Wednesday, we should feel comfortable saying, okay, it's definitely not inside your uterus. It's definitely abnormal. Let's get you over to the hospital and give you the methotrexate treatment.
Okay. So this is really bizarre. This has never happened to you.
I've never seen this happen this way before.
Okay. So then I guess I'll see, should I just come in my regular, I have an appointment with you tomorrow. Should I just come in at my regular time?
Yeah, let's just do that.
Okay.
And, you know, in terms of, we made all our decisions based on the information we had in front of us, you know, Dr. and it's like, oh yeah, all these things make sense. And now all of a sudden your body's throwing a curveball. It's like, wait a minute.
Yeah.
What is going on here?
Right. Okay.
And in terms of your blood test, your white blood cell count wasn't elevated. So, I mean, in retrospect, it doesn't look like it was an infection.
Right, yeah. It's so weird.
So if you want to stop with the antibiotic, that's okay. I mean, I don't know if you already took one today or not.
No, yeah, I didn't, because I got some at the ER. They did some IV antibiotics, and then I think those last for like 24 hours, so I haven't taken it. I'll just stop taking it.
Yeah, I mean, because if your white blood cell count's normal, I don't see a reason for you to continue the antibiotics.
Okay.
I mean, we're only going to wait a day, so it's not that big anyway.
Yeah.
So.
And my bleeding is also getting worse than it was. Like at first I was just having some like brown discharge, but each day that goes by, it seems to be like getting a little bit more and more each time. I noticed this morning, like I had a lot more like blood than I have in the past couple days.
Yeah. Huh.
I'm just your little medical mystery now.
Yeah. Very, very unusual. But as long as you're okay in terms of the amount of discomfort you're having, and you're able to eat and drink at least a little bit, I think it'd be okay waiting to see me tomorrow.
Okay.
And then do that. I noticed that when they checked your blood count, it was basically the same as the last couple times we checked it. So
right.
You're not actively bleeding internally.
Okay, well that's good to know.
Yeah, well, that's always good to know.
Yeah.
Because if that was the case, your blood count would have definitely been lower than the time that we checked it before, and it was basically the same.
Okay.
So I guess in terms of what they saw in the CAT scan, I guess theoretically maybe the pregnancy implanted behind your uterus and that little blood collection is pregnancy tissue growing in there,
okay,
causing the irritation and the bleeding. I guess theoretically that's a possibility.
Okay.
Yeah.
So I have, I'm actually have a flight scheduled to leave Tuesday and be gone until I think Friday. Should I cancel that?
Where were you gonna go?
I was gonna go to Philadelphia.
Yeah. Honestly, until we get this figured out, I don't think you should
go anywhere.
Make a big trip.
Okay. Okie dokie. All right.
I wouldn't want you to have something going on and you're out of town and you have to go into some random ER and
right.
That would be too anxiety provoking for both of us.
Okay. Okay. So then I guess I will just see you tomorrow, and if I start to have pain, I can just control it with my Norco that I have.
Right. Yeah.
Okay. Okay. All right.
So, well, I'm glad you went into the emergency room last night so that we would check this.
Right. Yeah.
Because it didn't even dawn on me that was a possibility that might happen.
Right.
Pregnancy test would stay positive. It's like, oh my gosh.
I know, it's crazy. I'm telling you, it's just, I've just had the roll of bad luck here lately, so.
Yeah, you are definitely an unusual bird.
Yeah, I know.
You're special, as they say.
Yeah, exactly. Okay, well, thank you for getting back to me so quickly, and I will see you tomorrow in your office.
Yes. Okay, Shannon.
Okay, thanks, Dr.